United States Olympic Committee Training Design Symposium. 2008. Randy Wilbur, Ph.D. Overtraining. This original lecture was about an hour and 30 minutes long, and these are the audio notes. Wilbur's definition. It's kind of like falling in love. It's hard to define, but you know when you have it. That's his definition of overtraining. Long-term overtraining. Weeks, months. Irreversible with recovery. Negative training adaptation. Performance suffers chronically. Competitive season is over. Characteristics for overtraining. Short-term. Days. Reversible with recovery. Positive training adaptation. Necessary to improve performance, especially at elite level. Wilbur's experience. Elites need to experience a season of overtraining before optimizing training to understand where wall of danger is. That is the tipping point. Training model. Overreaching or overreaching, rest. Supercompensate or train microcycle of 3 weeks. So that was an example of a training model with overreaching, rest, meaning the supercompensation is going to come right after the rest, meaning the training microcycle of 3 weeks. Recovery cycle, supercompensate. Next training microcycle. Again, kind of following the same sort of pattern there where you have recovery cycle, then you supercompensate, then you have the next training cycle. In other words, that should reduce or negate overtraining. Overtraining model. Or, I keep saying or because I'm using that as overreaching. Overreaching. That is training microcycle of 3 weeks, then another training microcycle of 3 weeks with no recovery cycle. That was an overtraining model. With recovery cycles, athletes experience improved performance and tolerance to training. Without recovery cycles, athletes will overtrain. Training model number 2. Undertraining can lead to active overload. Overreaching, overtraining. That is the zone of enhanced performance. Active overload, overreaching, and then you stop right there. That's the zone of enhanced performance. But if you keep overreaching without recovery, ultimately you lead to overtraining. Both ends of spectrum. Model 2 have increased or ignored recovery cycles. Overreaching cycles. Challenge can be to get athletes to brink of overtraining without actually overtraining because there's a thin line between overtraining and overreaching. 22% of USA athletes from 96 Olympic Games reported overtraining and identified these needs for future performance gains. Taper, rest, travel less, and stay healthy. So those were the things that they identified or reported after the 96 Games for increased performance. Taper, rest, travel less, and stay healthy. So I'm gonna go back over a couple of things that I think are extremely important. The challenge can be to get athletes to the brink of overtraining. So that's suggesting that in order to have, a reward, a high reward, you're going to have high risk. And I guess the challenge is to really figure out what the brink of overtraining is, and you want to go right up to that level or edge and pull back again. This is for elites, and the Olympic Committee defines elites as top 8 in the world and or world class. So you want to go to the brink of overtraining, and then you actually want to recover. If you do not do that when you're at the elite level, you could possibly be undertrained, and or other athletes may actually be doing that with a very good periodization model when they recover and or when they taper, and then that could be the difference between you and them. Great athletes paradox. What often makes them great athletes also makes them more susceptible to overtraining. They may have difficulty pulling back from overtraining based on personality or understanding periodized training plan. And that same last phrase there actually happens with coaches as well. If they have difficulty understanding the periodized training plan, they could actually overtrain their athletes, and or athletes could actually overtrain themselves if they don't understand as well. Coach must teach, apply periodized training plan. Athlete must work, listen to coach, and vice versa. Bobby McGee, an endurance coach, quote, "More performances are spoiled by slight overtraining than by slight lack of fitness. And an athlete who is 50% conditioned for an event will do better than an athlete who is 0.5% or 5% overtrained." That's a quote, and I guess the rationale there is you can be, way more undertrained than just a little bit overtrained. If you're just a little bit overtrained, that's slightly less than average athlete can actually probably beat you. Slightly less than average elite athlete. You always have to throw elite in there because elite athletes they're not normal in terms of the amount of training that they've accumulated over the training years. Once you become an elite status, you in this example, you can be not even at your best, and you can probably beat someone who's overtrained, even if they're much better than you. Performance symptoms of overtraining: consistent decrease in performance, prolonged recovery after training and competitions, reduced tolerance to training, that is, can't complete sessions, decreased muscular strength, loss of coordination, technical skills decrease. There are about 150 plus characteristics of overtraining, and that's the challenge. The challenge where there isn't one single marker, and there's another actually audio notes that we talk about measurement, and using some of the measurement tools you can kind of help yourself figure out where the overtraining line is, and I think this lecture actually goes into that here in a little bit. Psychological symptoms of overtraining: general apathy and lethargy, lack of concentration, mood changes, decreased self-esteem, fear of competitions, gives up when going gets tough. Mind appears to affect or synergize overtraining symptoms. Those last two kind of symptoms were performances of overtraining and psychological symptoms of overtraining. So I suggest you just kind of listen to those again, because there are so many different symptoms, and again, there's going to be information here regarding measurement, and you may be able to actually measure other characteristics so that you can not know or not get into overtraining. Models of overtraining: number 1, glycogen depletion, quickest fix. Model number 2, immunosuppression, that is, increased cortisol and increased sickness and injury. Model number 3, autonomic nervous system balance, parasympathetic and sympathetic overtraining, challenges many characteristics, different, opposite, or the same, so it's hard to tell what the heck's going on. Overtraining is a complex picture. Number 4, central fatigue, brain and blood chemistry affected, that is, brain releases serotonin, which affects lethargy. Number 5, elevated cytokines, affects brain, central nervous system, and hypothalamus, that is, brain chemistry. Preventing overtraining. Prevention is an art and a science. We don't have all the answers yet. However, tools will help decrease overtraining symptoms and overtraining. Strategy number 1, scientifically sound program, that is, periodization. A lot of athletes do not get rest, recovery, and regeneration. Coaches and athletes need to think over the course of an Olympic quad versus 1 year, 1 month, 1 week, and 1 day at a time. Get taper right, that is, exponential tapers appear to work better than step and linear tapers. Reduce volume and intensity during taper. If above protocol is followed, decrease in cortisol and increase in testosterone, decrease in creatine kinase and increase in oxidative enzymes, increase in liver and muscle glycogen, and increase in muscle fiber size and power. Strategy number 2, detailed monitoring of training response. Bompa and Kelman's book have excellent tracking devices. Track on a weekly basis, that is, sleep, food, soreness, mood for training, can be placed on a grid. Rescue and recovery cue, monitoring in parasympathetic and sympathetic nervous systems, that is, heart rate variability. Heart variability, RR interval, can determine if athletes are overtrained. Strategy number 3, nutritional intervention. Carbs. 4 of Wilbur's models indicate lack of carbohydrates. key indicator for overtraining. Replace ingest high glycemic protein cocktail immediately after training. May be difficult to eat right after training, and drinks may work better. That is up to 2 hours post-workout. Insulin response is increased after training, and protein increase in the insulin response. Body is hyperactive in transporting glucose, glycogen, and protein post-workouts. Gatorade, Powerade, etc. will place these depleted stores immediately after training. Tests show body absorbs more carbs if ingested 2 hours post-training versus 4 hours post-training. Glutamine, a supplement that aids in mixed white blood cells recovery, also helps replace and restore damaged muscle cells, according to studies. Strategy number 4, biochemical and biological markers. Blood chemistry. Oxygen transport, that is hemoglobin, has 4 atoms of iron. Iron transports oxygen. Millions of hemoglobins in each red blood cell. Erypoiesis equals synthesis of red blood cells. Athletes are predisposed to lack of red blood cells or anemia because of diet, menstrual flow, training, sweating, and weight loss. 3 stages of anemia, with each stage progressively getting worse. Some iron supplementation may help by ingestion, modifying diet with iron-rich foods or over-the-counter supplements. Cortisol, marker of psychological and physical stress. Powerade may decrease cortisol levels. Creatine kinase. This leaks out in the bloodstream when muscles are damaged or traumatized. Leukocytes or white blood cells. When athletes train hard, white blood cells, or during periods of intense training, or neutrophils decrease and lymphocytes increase, and blood chemistry tests can detect this abnormality. Eosinophils, another white blood cell, responsible for allergies-induced exercise or exercise-induced asthma, increase and are abnormally high. Strategy number 5, training guidelines during illness. Yes, if symptoms of cold with no systemic involvement. Submaximal exercise and short duration maximal exercise. No, if systemic involvement, that is fever, extreme fatigue, muscle aches, swollen lymph glands, etc. Submax and max exercise are not suggested. 2 to 4 weeks of recovery. If you have those fever, flu-like symptoms and you're ridiculously sore and you have swollen lymph glands. Strategy number 6, passive rest. Human growth hormone spikes during rapid eye movements, deep sleep. Cortisol decreases during REM and deep sleep. Human growth hormone is an anabolic hormone and essentially grows the garden during sound sleep. Grows the garden recurs or suggests fertilizing. So when you're sleeping, if you go into REM sleep or deep sleep, when you sleep at night, human growth hormone spikes and your body actually adapts better to training, which leads to high performance training, which is going to have your body much better recovered and ready to go the next day. On the flip side of things, if you're not getting enough sleep, then all of that training that you can be doing can be for naught because you won't realize it, because your human growth hormone that's naturally in your body will not have an opportunity to spike. Rest and naps may also help, but not to the degree of deep, long REM sleep. Therapies modalities include swimming pool, sauna, cold plunge, contrast plunges, acupressure, massage, and monitoring hydration level. Hydration levels should not decrease more than 1%. So those were other examples of strategies to prevent or kind of monitor your body so that you would be better recovered to prevent overtraining. Summary: overtraining is common among elite athletes due to heavy training loads. Difficult for coaches to distinguish overtraining versus overreaching. No single marker can identify overtraining in athletes. Recommendations to prevent overtraining: periodized plan, monitoring training, nutritional intervention, blood testing, and recovery techniques. Those last several ideas: swimming pool, sauna, cold plunge, contrast plunge, acupressure, massage, and monitoring hydration level. Those are some of the recovery techniques that I'm referring to. Overtraining warrants continued research. Under recovery versus overtraining. That's a term that we can use with athletes so we don't, create even more anxiety, which will actually increase the overtraining symptoms and or response. Under recovery is a term that's a little less, not as hard. It's a softer version of saying overtraining. Athletes can get more rest, sleep, and or is better psychology to deal with for athletes. So that's, again, certainly how we phrase words and or terms can help athletes kind of deal with them a little bit more. And one way that we can challenge athletes is say, hey, you're under recovered, you need to get a little bit more rest. Hey, you're under recovered, you need to take one or two less intense practices and bring some of that in. Keep the intensity high, but maybe a little less, maybe do a little bit less of it. When we challenge athletes, they're always able to actually probably respond to it versus saying they're overtrained, which is maybe going to scare them into working even harder, and that could, again, deepen the overtraining symptoms and or response. So there was a lot of information in this. Again, I suggest listen to this 2 or 3 or 4 times. If you listen to all of these audio notes, I'd say upwards of 8 or 9 or 10 times, I suggest that all of this information will make sense. Again, that's what we like to call deliberate practice in order for you to really understand the information at a high level and become a high performance training coach.